When you think of vital signs, what is it that you think of? Maybe you think of temperature or blood pressure. Do you ever think of pain as a vital sign? Pain is the fifth vital sign. So we have temperature, pulse, respirations, blood pressure, and pain. 5 vital signs that should always be measured by a healthcare professional. I want to share with you where I keep all of my little tools and things when I want to do a pulse ox or temperature. I only started purchasing a pulse ox little gadget around COVID time because I have asthma. Of course, anybody who gets COVID, that's one thing. It was really it is a respiratory illness, but the first year of COVID, wow, I mean, that was really scary. So you want to keep an eye on your pulse ox. So what are these vital signs? So of course, temperature is our body temperature. You can take a temperature oral, axillary, or under the armpit. You can take it rectal. You can take it in the ear. You can take it when you go across the forehead here, do a little tap back there. But this is the most accurate way to take a temperature. It's okay to not be comfortable doing a rectal temp on your children. You do not have to. I know for a fact, my 2 kids, my sons are raised now, and I never took a rectal temp on them. I always tried when they were old enough to do it under their tongue or to do it in their ear. I think that getting an accurate axillary temp can be tricky, and I'm going to show you why. So let's start with that. Here's the bag that I use, and it's canvas. I have this little charm on here. I have had this, and I have had the small one for many years now. This is how everybody can kind of just grab it and know if we need to take a temperature or anything, we need to check a pulse ox or a blood pressure, everything's going to be in this bag. I got it off Etsy, and this lady makes these. These are solid, beautiful. The lining inside is like like a coated faux leather kind of plastic feeling. But I love that because it's waterproof, or at least water resistant. So if we go in here and we're going to start, what did I say? Temperature. So let's start with that. There are so many awesome thermometers out. Here is one that I love, and I have a couple of these because they're anywhere between like $7 and $10. You can get them off Amazon. You can get them at Target. They're pretty much always in stock, any drugstore, and it's the Vic Speed Read Thermometer. Fast and accurate, gentle, fast, and easy to use in as little as 8 seconds. I also like that it has colors down here that's going to tell you right away, no temperature, and high fever or significant fever here. I think that it's good. This is big enough. You can read it really well. This is really just one of my favorites for the money. I have, like I said, a couple of these. It does say you can use it for oral, rectal, or under the arm. Just be careful if you're going to do a rectal temperature. Even though it's accurate, just be really careful because children move around a lot. You can accidentally perforate. It can become really painful for children, so you don't have to do that. There are other ways to get a temperature. And then the good old-fashioned way of getting a temperature is like this. Remember that? Remember when your mom would just go, you have a fever. Here's my thermometer. This one is already out. So let's start with this one. The next one we're going to go to is the brawn. And this one goes here in the forehead. And the other one, my son currently is getting over COVID. So he's isolated upstairs in his room, and that thermometer went in his room with him. The only thing I like better about this one is there's a way to turn that noise off on most of the thermometers, except the one upstairs. So if you had somebody who was resting, or you don't want to hear that loud beep, there should be a way that the noise can be turned off or turned down, if that's something important to you. Okay, so let's start with this Vicks one. Super easy. Doesn't even come with instructions. It just has a few little words on the back, and that's it. It's battery operated. Here we are. We're going to turn it on. Okay, there it is and ready to go. Let's take mine oral first. So remember, oral temperatures are done under the tongue. And while I go through the vital signs, I'm just going to give you some little tips on how to get it accurate. It's real easy for adults and children to put it under their tongue, and then it goes on top, and then it goes over here, and then it goes down here, and then we're like, okay, your temperature's fine. So it's best to have it lodged under the tongue pretty snugly, if a person can do that. And please, please don't do this whole ice water, sipping water, or hot beverages, and then stick this in your mouth. It does make a difference. Okay, so here we go. Okay, here it is. It says 97.9. And I don't even know that you heard it beep. It's very quiet, and it only beeped 4 times. And now the light goes out. Okay, so let's compare. So here it is. Here's our brawn. The brawn even gives you a picture that shows when you're going to do this, you're going to do this right here. Don't go up here. Don't go over off to the side of the face. You know, this isn't the kind that you're going to do back here. It's going to go right here in the center. And this type is okay to touch. Other types, you just go super close and you don't have to touch straight onto the skin. Okay, we're on. Here it is. Fahrenheit. You can change it to Celsius if you want. And here is the button on the brawn where if you don't want to hear it beep, you're going to turn it down. Okay, so we're going to go ahead and put this on our forehead. Here's our button right in the center like it shows. That was super fast. 96.9. Let's take it again. I'm holding my finger down on it. 97.2. Okay, so that's okay. You're going to get a little bit up, a little bit down with all of the vital signs. Just like they say when you go to the doctor's office, if you're running from your car in there and 15 or 20 minutes go by, that is if your doctor's on time, and you sit down to get your vital signs done or your blood pressure done, it's up a little bit. They might wait, take it again. It's going to be different. It's going to probably come down. All right, so we got temperature done. Document our temperature. Now, let's go on to pulse ox. Oh, wait. We don't have our temperature done. One more thing. I want to talk to you about an axillary temp. This is something that people get wrong a lot. And that is, especially with children, and they're putting it all the way in the back. Now, of course, I'm not really doing it, just demonstrating how it can poke out the back. That's wrong. How sometimes people just lift an arm up, straight up, and they'll just poke it straight in the center and cram the kid's arm down and hold it. You want to get it in the middle and preferably close the arm down while it's secure, not poking in. Hoping this makes sense. All right, so let's try mine. Turning it on again. This is the Vicks one. It's ready to go. My axillary temp is 97.4. Let's find somebody else in the family. Okay, so I've recruited the husband. Let's go over here a bit. Okay, we ready?
Mm-hmm.
Right.
Or do you want this side?
Yeah, that side might be better. We've turned it on. Here we go. Here's the tip. We're not going to cram it in there and slam his arm down. We're not going to have it poking the tip out of the front or the back. We're going to go straight in the center and put the arm, go back up again. Yeah, and just relax this. Give it a second. This is like an 8-second thermometer. There we go. 97.8. Okay, hang on. Let's do yours right here while you're here. 96.9. Are we having fun?
Loads.
Playing doctor. Okay, moving along. I want to do the pulse ox. Here's mine, and I need a new one. So I'm just going to demonstrate, but I want you to know it's not working. Here's the biggest thing to remember about, this is a Walgreens one. I can't find my other, but the biggest thing to remember about a pulse ox, and you'll see this even in the clinic, is they'll go like this. Beep. Okay, there it is. 90, 97%, 98%. It should go in here securely, and you're going to wait. It will start beeping. Pulse oximetry is the measurement of the oxygen in the blood. It will also show not just that percentage for oxygen, it will also show the pulse. So you get two things when you're hooked up to the pulse oximeter. So that's how long it should be on, because initially the first couple beeps are not accurate. It has to go on and stay on for 10 seconds, 15 seconds, and then you have an accurate reading. If you don't believe it, and that just seems like this is really low because it should be preferably between 96, 97% and 100%. And if you take your pulse ox and you're feeling really great and it says 93%, keep it on, let it adjust. Oh, 92%, geez, that's going the wrong direction. Get up, take a deep breath. Try to clear out any junk that might be in your chest or your throat. Give yourself a good cough. Try it again. Put it back on. Put it on a different finger. Put it on a toe if you want. You can do that. You can use any finger or any toe. When you're in the hospital and this is on your finger, there are different kinds. This is a pretty bulky one, but there are also the wrap kind. And just something to keep in mind that if a wrap one is taped down onto a finger and you're in the hospital for, 6 hours has gone by, 12 hours, you're admitted to the hospital, a day or two has gone by, that pulse ox tape should be unwrapped and it should be placed on another finger. This should be done, well, actually, it should be done every shift. Just something to think about. All right, moving on. We are going to move on to blood pressure. This is my blood pressure. Now, remember with the blood pressure too, each one is going to have a little different way that they want you to do it. This one is the over the heart like this. You want to have both feet on the ground. Try to relax. There are other kinds where they want it to be resting on top of a table. But what you don't want is it to be higher than your heart. It needs to be heart level, chest level, or below. Okay, so this is my wrist one. Some wrist ones go here, some go on top. There are some that can go on the lower leg, they can go on the thigh, etc. Okay, here it is. I'm going to press the button now to start. Can you hear it? It's pumping up. I'm going to sit still and try not to talk. Okay, it stopped. It is 114/73. All right, so I'm happy with that. Okay, so we've done temperature. I've shown you a couple different ways to take the temperature, the importance of getting it in the right place under the armpit, not sticking out the back a little, not sticking out the front, not poking straight in. It's important to get it in the right place for it to be accurate. Under the tongue is good, just don't have anything cold or hot to drink or eat before you're taking your oral temperature. You don't have to do rectal, even though rectal is considered very accurate. You don't have to do that one. We've done blood pressure, pulse ox, and temperature. So let's look at respirations. Respirations are breathing. How many breaths per minute? Same with the pulse. How many heartbeats per minute? With respirations, with your pulse, and even with your pulse ox, it's going to vary per person. Some people who have maybe COPD or who have a lung disease or who are smokers, their normal pulse ox or cystic fibrosis, different types of things that affect their lungs, their normal pulse ox is going to be considerably lower or in a range that's lower than people who have healthy lungs. For a pulse, it's okay to do this brachial pulse, but remember your thumb, you don't want your thumb on here because you're going to feel your own. You want 2 fingers right here. And preferably, again, you want to take this for 1 full minute. or take it for 15 seconds times 4. If you want to take a pulse here, that's radial. If you want to do brachial, it's inward. I feel mine really good right here. And remember, when you're getting this, you're going to do it next to the thumb side. And this, inward. Now for me personally, I can't feel these carotid arteries. I don't feel it as well as I feel it here. Sometimes with patients who've had pelvic injury or from the waist down, different types of surgeries, or somebody who has congestive heart failure, various reasons, you might do something called a pedal pulse, and that is just feeling on top of the feet, right on top for the pulses there. Do you feel it on both sides? Is it equal? Is this foot and ankle really swollen compared to this one? So you're just measuring it that way. Sometimes we have to do pulses in all areas of the body. Okay, so back to pain. I wanted to mention with the pain scale, I hear you when people say, I don't know what to say. I don't know what a 2 is. I don't know what they mean. Tell me your pain, 1 to 10 pain scale. Well, when I'm moving or when I'm still, or when I'm coughing or when I'm not coughing, or when I'm going up the stairs or when I'm not going up the stairs, you know, all the time or some of the time. Because it varies depending on the activity level, right? And I understand it is difficult for some people to understand, and then they get overly medicated or under medicated based on their perhaps misunderstanding on their subjective explanation of what pain is to them. And whatever that person's pain is, that's their pain. We have the 1 to 10 pain scale, and I think that it's a good idea to remember that you can get pain medication if you say, I have just a constant 4. That doesn't mean 4 is nothing, you don't get anything, so therefore you're going to say you have something else. Just say what your pain is, but I'm fatigued by this pain. This is unrelenting pain. It is a constant 5. Whatever it might be. Now, if somebody does say a 10, what we try to explain to people is that 10 is considered absolutely intolerable. And when I fell on my stairs on the 4th of July recently and thought that I had cracked ribs, when I got there to the ER just to get some x-rays done, they talked about the pain scale a lot with me, and they did say 9 or 10 means you're on fire. Are you on fire? Well, no, I'm not on fire. I'd say then it's probably a 5 or 6. But, you know, so it's not intolerable. It's tolerable, but it's awful. Okay, so that might be a 7. I can't take it anymore. I just can't take it anymore. This migraine is absolutely killing me. This is a 10 for me. Then it's a 10 for you. Everybody's pain is different. It is subjective to that person. What we see is that, you know, that's true that, you know, this whole pain scale thing has gotten a bad rap. You know, it's hard because people come in and might say to the doctor, it's a 10, and then and they're on their phone the whole time, or they're talking to somebody the whole time. It's a 10. Is it real? Are you on fire? Is it a 10? Is this the most intolerable, ready to jump off the bridge kind of pain that you have ever experienced? Someone who's crying out in pain, can't even use their words, writhing in pain. There are different types of pain. So yeah, I would say it's difficult for healthcare providers because they're asking that all day long to everybody, children and adults, and we're trying to gauge that based also on their physical activity. Someone might say, I have a 7. It's just terrible pain. It's a 7, but then they are, you know, outside smoking a cigarette with their IV pole. Is that really a 7? It's a 7 to them. It's difficult. It's so difficult. I personally hate the whole pain scale thing. There is the FACES pain scale. So we use that for kids all the time. So the FACES pain scale, I'll put it up here so you can see it. Usually it's 1 to 5, or it can also be a 1 to 10 for the FACES pain scale for young kids, even adults. I think that the FACES pain scale is way easier than the number, just give me a number. There's also another way to do pain, mild, moderate, or severe. That's my personal favorite because that just is a pretty universal. And you don't have to be going down, what's the difference between a 6 and a 7? Is it really a 7 or is it an 8? Oh gosh, just, you know, mild, moderate, or severe. That works. When you are given pain medication, if you are in the hospital, the provider who gives it to you, nurse, nurse practitioner, whoever's giving you your pain medication, is going to be asking you, what's your pain? Here's your pain medication. So now I'm going to be back in an hour or two, and I'm going to assess your pain again. That's the right way to do it. I don't know, how many of you guys had that? I know when I had my rib done, how is it people go in and come out with narcotics? I've never gotten narcotics, even with a complete tear of my labrum off my hip. Still never got narcotics. But with my rib, I got 2 Tylenol and I got a lidocaine patch. But that was it. I got that for pain, and then I never saw anybody again for 3 hours. Not a single solitary person for 3 hours. So that really wasn't done right. That's not how it's supposed to be, but whatever. Nobody's perfect. I'm not trying to criticize. I know that they're busy, but I'm just letting you know that in case somebody gives you pain medication, they come back an hour later, what's your pain now? It's because we are supposed to be documenting that. Because if someone gets pain medication and it's up or it's worse or there are other contributing factors going on, we want to know that and we should address those things. So vital signs are the clinical measurement of our body's function. As I mentioned, we went over what the 5 vital signs are. I didn't tell you though with the blood pressure, the systolic is the top number, the diastolic is the bottom number, D for down for diastolic. And with the diastolic, that is the force of the blood hitting against the artery walls at rest for diastolic. But for systolic, that is the force of the blood against the arteries during the time that the heart is pumping. How it was explained to me many years ago in nursing school was systolic is when your heart is active and beating. Diastolic is when your heart is resting in between the beats. I hope this was helpful. And if you like this kind of content, medical information, medical mishaps, just some learning some health tips, please consider subscribing.